The title for presentation is called Leveraging Book Clubs as Prevention. The subtitle of the presentation is Breaking the Cycle of Drug and Substance Abuse. So we're going to talk about the Read for Your Life Book Club, which is a prevention program that was started in a grassroots community to break the cycle of drug and substance abuse. A little bit about the background of the presenter. I'm a registered community psychologist in Zimbabwe with a BSc in psychology and MSc in community psychology with a certificate in monitoring and evaluation in global health. Also a member of the Zimbabwe Psychological Association and the founder and team lead of the Read for Your Life book clubs. I've also worked on a number of prevention projects on children's mental health. And one of these are support groups, mainly the My Safe Space support group, as a support group for teenagers fighting drug and substance abuse. So we get into the presentation with a little bit of, we'll talk about the prevalence of drug and substance abuse, mainly in the Midlands region where the program is mainly centered in. So a study carried out in Zimbabwe in 2019 indicated that the prevalence of drug and substance abuse was at 57% among young people, and the most commonly abused drugs were alcohol and marijuana. But we see that these statistics have since changed given the COVID-19 pandemic, which hit around 2019 to 2022. So these statistics have doubled and have cheaper intoxicating substances that are flooding the country. And the most commonly abused substances include crystal meth, cough mixtures, and combined substances. One research project that was carried out in the Midlands regions as well, it's called the DAS project, Drug and Substance Abuse Project. It shows that children started to experiment with drugs around 11 years. These are probably grade 6 pupils. So that's the prevalence of drug and substance abuse in the area. Let me get to the background to the study. So studies show that children who are raised in homes or communities rife with substance abuse are at risk of engaging in substance use later in life, largely due to the environment. We talk of the gene-environment interaction, or otherwise called epigenetics, where we know about environmental influences impact on genes, and probably mostly to do with find that children who are raised with either parent or primary caregiver who had a substance use disorder, it affects even the health of the children before they are born. So maybe we're talking about the biological makeup of how substance use or drug use affects that as well, posing the children to become at high risk of becoming substance abusers also later in life. Then we talk of abuse, which is most commonly with children raised in homes where there's a substance use, parent or primary giver with a substance use disorder. So a parent with a substance use disorder is 3 times or more likely to physically or sexually abuse their child. It impacts on the children's behaviors, their attachment style, and their coping techniques. So look at the community that the project was carried out. It's a semi-rural community, but look at it. The scenery is beautiful, the community is beautiful, but it has also a lot of downsides to it, mainly because the children are reared in homes that are rife with substance abuse. The parents or the primary caregivers are dependent on alcohol and substance abuse. And the main activity in this area among the youth and the adolescents is drinking and substance abuse. And crimes such as theft and violence are a great marker as well in the community. A number of children attend school, but they lag behind from their peers who are coming from stable homes in this adjacent suburb in the area, which means that these children are at very high risk, given the environment in which they're coming from. So the idea of the book club is mostly, we have there probably it's a parent with an SUD shouting at their children or neglecting them in any other form. And then what the book club is aiming to do is to have an environment conducive for the children to stimulate positive growth and positive mental well-being. And in the end, we're aiming to achieve to have a resilient young adult who's got positive coping skills, and we have eliminated or delayed initiation into drug and substance abuse. So the theories that were guiding the program, we have bulbous theory of attachment, and with bulbous theory attachment, we know the importance of having positive primary attachment with children, especially at a young age. And in most cases, which forms of if the parent or primary caregiver has a SUD, we talk of anxious attachment style. And then we have the ecological perspective. Basically, we're talking of the closest level, which is the microsystem, the home, the environment in which they live, and things like that. So those were the two guiding theories that we formed this program. So how data was collected. Snowball sampling was used to reach the target population. An initial sample of 14 children aged between 6 to 12 were identified. So one child was initially identified as the key informant, and then snowball sampling was implemented. So initially, observations were carried out in the area, just looking around what it is like and things like that. And then data was collected using the parent or primary caregiver interviews. And then the pediatric symptom checklist, which is basically a brief screening questionnaire to recognize psychosocial problems and improve treatment in children. So the PSC-SC would measure 3 subscales: attention, internalizing, and externalizing. Then we had kinematic family drawings as another instrument that was used to collect data. So basically, KFDs are a type of projective test to assess the relationships within the family. The results from the interviews included the major themes that were derived from the interviews. There's a lot of role reversal. When children take on the role of the parent, the children now become the caregiver. They're nursing their father or mother who has an SUD. And we have the children also presented with an anxious attachment style. There was indicators of neglect and abuse. So the children raised in homes with a parent with a substance use disorder, when asked what they thought about their children taking alcoholic substances, one parent commented saying, "It's their choice whether they want to or not. I can stop them since I already do it." I mean, that statement alone shows a lot of neglect. Right, these are the results from the PSC. So the children mostly scored high in the light blue color, which is externalizing subscales. And of course, we saw in the green, the lighter green shade, those are attention disorders. They also scored high in that. And then we have other instances where they showed a little bit of internalizing disorders, but overall, we can say externalizing disorders is good high on that subscale. And also from the KFDs, the children drawings from the children depicted a disintegrated family setup, but also from the drawings, we could see that the school and church were great support systems that the children relied on. Then a summary of the results that are collected from observations and interviews show that the children presented with bullying tendencies, anger, shyness, and withdrawal from social situations, and negative coping techniques. Most of these as well are also externalizing disorders. Children scored high on attention and externalizing subscales on the PSC-17, suggestive indicator of disruptive behavioral and attention problems. The school and the church is a safe place for most of the children. Right, then we go down to the logic framework. That is basically what was invested, what was done, whom we reach, the short-term results, the intermediate, and the long-term results. So prior to the program, we had voluntary members from the community to help spread awareness on drug and substance abuse and its effect on mental health, especially among children. We had storybooks coming in and refreshments, sanitizer, what was done. So with an awareness raising campaign on substance abuse, a WhatsApp online support group for parents or guardian interested in the program. So we'll talk about the outcomes in the next slides as we go. So how the program was implemented. So the book club program uses a three-pronged approach, targeting maladaptive behaviors, fostering positive coping techniques, building self-esteem and confidence, and also support from community members and the caregivers. So the program activities included structured book reading of children's storybooks. So take all storybooks and then start kind of like these are the storybooks that would teach on resilience, these ones on emotional regulation, these ones on anger management, these ones on, a certain different topic that we want to foster in children. And then there'll be lesson storytelling and providing feedback loops, and also additional activities in the program included sound walks, yoga for kids, and story writing. So there's always this need for program scale up and continuity. So the program was well received in the Harbour Park community. That is another community. And as well, initial observations and community mapping was done just like how it was done in the first community. So Harbour Park will be community B, Riverside is community A. So identified participants have been set up since March 2022. So the older children in the book club in community A, those boys, they embarked on book sharing campaign as they went around to share stories and lessons learned with other kids in the Harbour Park community, or vis-a-vis community B. So the partnerships and awards to date, the Read for Your Life Book Club is proud to mention that it was part of the winners in the Amber Spark Award from SHM Mental Health UK. And Read for Your Life Book Club is also part of the Books as Bridges program by the International Book Project USA, and it is partnered with Glendover Elementary School in Kentucky. It's more of a cultural literacy exchange program where the kids write stories to each other. They learn more and appreciate more about the different cultures across the globe. And the program is made possible by the International Book Project, which is also one of the greatest funders of the library books we have to date. So that's something to share. Right. When we talk of growth and change, this is 2019 when we began during COVID-19, and 2022 when the project was finally launched, but had been also running. And it's quite amazing. This is still community A in both pictures. The results to date from the program, children now have an understanding of emotions and emotional regulation themselves and those around them. Improved communication, that is feedback among other peers and adults. So with there was a post test of when we used the KFD, we had to use the KFD again to see if there was any improvement, especially with the drawings. It shows a quite a huge improvement, as kids would draw a happy place as a book club being a happy place or a safe place for them. And there was also notable changes in the PSC 17 after a post-test. So there's improved self-esteem and confidence and learning about people, places, and events that they couldn't learn otherwise. This gave the children a deeper understanding of the world around them, the cultures that are different even from their own. That is through the Books as Bridges program. Right. So, in conclusion, the future is to provide an environment that fosters positive growth and cultivates improved mental well-being, an environment that continually fosters resilience in children. So, the picture on my right, this is what we hope to achieve one day in every community, that safe space for children to thrive despite the environment in which they're coming. Right, so that is it for us from the book club. Thank you.